Now you hear about Mulago, Director Mulago took off with our money, taxpayers' money. The money which was supposed to be used to take care of our patients or take care of hospitals or Mulago itself to give a good service. But doctors, however, on strike, the different health workers are having problems. They have no money, they are not well facilitated, their activities.
Government is you and I. Once we improve our spaces, we all take the credit. Some of the equipments in government hospitals are intentionally broken, not maintained. Doctors who are holding medicine and they create demand externally. You go to Churudu, Kawempe, Chitebi, Mulago. The services are available. You look at the stock card. Everywhere there is a public hospital, there is a nearby clinic, or there are nearby pharmacies.
It is overwhelming. The demand is higher than the supply. So I would invite even to the political figures that once in a while come and observe. You will realize that it is tough. They come and run and say, "Sister, she's here. She's in charge of maternity. Sister, we have run out of a fluid." Oh, PD, they can say, "This child has been sent without an attendant and the baby is convulsing." And you are seated in the office as an administrator. And they are standing saying, "Sister, can we refer?" But the child will not reach. But we could first give a Valium. Do we have the Valium? No, it's then you have to enter. Nobody knows how much you came with in your pocket. But you will pull the little and say, "I'm an administrator." You first go and buy Valium. We first give the child and stabilize. If it is a mother, doctors and the midwives, those good ones can even pull and say, "Let's first get a fluid." Why? Not because we didn't quantify. The system has not yet been revised as per that level. Help us to see that our budget allocation is improved.
You talked about the geographical catchment in terms of planning vis-a-vis the demand that just keeps shooting every day. When we were in Iganga, I think it's the Iganga main referral hospital, they talked of the same issue. They said, you have no idea how many districts surrounding Iganga, beyond Busoga, Greater Busoga region, all of them converging to our center. So if you think that what government allocates are according to their plan a decade ago, before the census and planning, that it applies today, it's not even 10%.
Let's not castigate much these people, psychosocial capacity of our health workers. Not only health workers, but also the support staff. If we find space within these facilities of talking to people.
Before a health worker undertakes a procedure or even touches her to examine her, she's supposed to be given a chance. They explain to her and she gives informed consent. So it is attached to information, informed consent, and respect for their choices and preferences, and companion of choice.
Salary alone, even if you increase, it doesn't motivate enough. Yeah. We do it in terms of allowing them to have a sack where they can get loans. We give them meals, we give them free deliveries, we give them medical insurance.
We are setting up a task force for Lubaga division, and this task force is going to promote and advocate for respectful maternity care at different facilities. This is the composition of the task force. The DMO, number one, we have 2 VHTs, village health teams, and one is from Lubaga North, and the other one is from Lubaga South.